What are some of the technological kind of hurdles or challenges in advancing the science and knowledge in that area?
Yeah, it's a good question. So we are working in a very regulated space with our products. So predominantly, most of our products are medical devices. And within that medical device space, there's no differentiation really in terms of classification between an implantable catheter or a ventilator as there is to a lubricant. So you can imagine when you're trying to develop products or advanced science within that space is quite difficult. You're working within a grey area within an overall regulation. So as part of that, when I think about product development and I think about how we, develop our lubricant formulations, it means that we are developing formulation-based medical devices as opposed to a single device. So it can be quite challenging. Thinking beyond that and moving into other guidelines and regulations, when we develop lubricants, as a specific example of one of the products we work with in intimate wellness, we need to make sure that we are developing those so that they're as close as possible to natural vaginal secretions in terms of things like pH and osmolality. So it wasn't a surprise really when we saw some of the guidelines moving towards that recommendation that you would need to have, you'd need to be developing your products so that they're in line with those natural, the natural environment in which the lubricants are going to go. So when you think about putting that together, it raises a lot of questions. So questions that we had to answer, well, I say we, but our formulators had to answer in terms of how can we develop a product that's going to kind of meet those requirements when actually some of the ingredients that we would typically use in our lubricants to make them lubricating, to make them be able to do their job of reducing friction, are actually the same ingredients that would potentially increase the osmolality of those formulations. So we had to kind of find a way to find a balance between, okay, we want to meet the guidelines that are coming through in terms of having a specific osmolality, but actually we also need to meet the needs of the consumer and make sure that we develop a product that is effective. So when you put all of that together, we've then got to think about how do we support those products? How do we prove that they're safe and effective, that they will actually relieve vaginal dryness and discomfort during sex, which is essentially what we want our lubricants to do and why they're in that regulated space. And when it comes to generating clinical evidence, again, there's no precedent there. There's no specific objective endpoints that you can just take to prove that a lubricant will be effective for any of those things. And so we've kind of had to find our own way in that space and be the leaders in that space when we think about how we generate our evidence and how we support, as Sam was saying, not only the fact that our products are efficacious, but also that they increase pleasure and how important that is